one of the famous orthopedic surgeons in Mumbai and across India. He specializes in spine and joint replacement surgery. He has dealt with more than 10,000 surgeries and has rich experience of 36 years. He has also worked in various hospitals in UK for super specialization in spine surgery and joint replacement. Let's know more about total hip replacement. Let's discuss what are the causes of total hip replacement.
The common causes or the reasons for hip replacement surgery is injury, where the fracture happens through the upper part of the thigh bone. Second most common cause is AVN, that is blood supply to the hip joint is damaged, and that leads to arthritis, which again becomes very painful and replacement is required. Other cause being infection like tuberculosis or improper development of the hip joint. The last or the least reason for the joint replacement surgery is tumor, where the tumor destroys the normal structure of the bone and it becomes painful, and then the replacement surgery is done.
Now let's know more about the procedure of total hip replacement.
This procedure is done in two parts. In first part, the damaged surface of the femur bone, which is the top of the thigh bone, is removed and the surface is prepared on the top. The second portion involves preparation of the cup of the joint, in which the pelvic bone, you see the cup here, which is reamed, and appropriate soft surface is created. On top of that, we put in an artificial joint, which is seen like you can see a half circle, which is coated with special material. Now this cup is put inside the joint like this, so this becomes your metal cup. And on top of that, now we have to prepare the thigh bone. So once your thigh femur is prepared, the canal is prepared, as we see here, is canal prepared with different size of material, and after that we have a special design of different sizes of what we call femoral stem. This goes inside the femur and it holds the thigh bone properly. Once that is placed, we have another part on this, that is the cup, that this forms the head of the thigh bone, in which you have two liners. One is a liner inside, which can be a ceramic liner, and the top of it is a plastic liner. This goes on top of the thigh bone and this becomes your thigh bone implant. So half the implant is placed now. You have a femur, and on top of that we have a cup here, so this becomes your joint. So this becomes a total hip replacement.
There are some frequently asked questions by the patients that will surely clear your doubts.
The most common questions asked with this surgery are how painful is the procedure. The pain is well controlled with analgesia, medicines and anesthetic local blocks. Usually within 24 to 48 hours, patient is very well controlled without medicines or occasional crossing. So pain is not a major factor after surgery. Second question asked is whether the hip joint will dislocate or the leg length will be okay. So the dislocation rate, I can say that in last 25 years, I have done a large number of these surgeries, and dislocation rate is practically nil. Though the international literature does mention the dislocation rate of between 0.1 to 1%. Another question is leg length discrepancy. During surgery, we put a lot of effort to get that the leg lengths are equal during surgery, and patient gets a nice range of movement and mobility.
Am I too old for the surgery? At our hospital, we have done hip replacement surgeries from the age of 21 to 90 years old for various problems of hip joint. If the person is medically fit and unable to walk because of hip pain, hip replacement surgery should be considered. Am I too overweight for surgery? No, though the normal weight is desired, but surgery can be done in overweight patients as well. After how many days I can start walking? Patient is made to stand next day after the surgery with the help of support, and gradually the patient can start walking. How long physiotherapy will be required? For faster recovery, 1 month of physiotherapy is required. After how many days will I get discharged? Generally within 3 to 4 days after the surgery, the patient can go home. When can I resume my activities? If the patient is fit enough, then within 6 to 8 weeks, they can resume all the activities without any support. How long will the inserted implant's ceramic piece last in the body? With the advanced implant design and materials, more than 90% patients have successful outcome of 20 years after surgery. After 1 year of surgery, I am able to lead a normal life and do all activities, including playing tennis. Any operation needs proper care and rehabilitation. Let's know more about how you should take care of yourself. Avoid bending forward with foot turned inside. Avoid crossing operated leg to other side with hip bent 90 degree. Avoid floor, low chair sitting. Avoid bending forward, instead, use grabber. Keep pillow between legs for 6 weeks. Use high commode extension. Testimony of total hip replacement.
नमस्ते, मेरा नाम सुधा तुंशियान है। मेरी एज 64 है। बहुत सालों पहले मुझे स्टीरॉयड रिएक्शन होता, एक दिन हो गया था बोथ लेग्स में, लेफ्ट में ज़्यादा राइट में कम। 2002 से मैं सर के टच में आई थी, पेन किलर लेके एक्सरसाइज लेके अपना गाड़ी चला रही थी। सर ने कहा था लास्ट ऑप्शन तो ऑपरेशन है, व्हेनेवर यू आर रेडी यू कम, हम आपको फोर्स नहीं करेंगे। बट सर वॉज वेरी कॉन्फिडेंट कि आपका पैर, मैं बहुत घबराती थी, बहुत डरती थी कि ऑपरेशन कराने के बाद पता नहीं आर्टिफिशियल पैर हो जाएगा, कैसा हो जाएगा। लेकिन फिर बाद में 2019 में जाके मैंने डिसीजन लिया और सर ने मेरा लेफ्ट पैर का ऑपरेशन किया। आई वॉज सो हैप्पी विद दैट कि मैंने सोचा भी नहीं था इतनी जल्दी मेरी रिकवरी हो जाएगी, मेरा पेन चला जाएगा और आराम से मैं वॉक कर पाऊँगी, स्मूथ लाइफ हो जाएगी। और सर ने तो अभी मुझे प्रॉमिस किया है कि तुम 2-3 किलोमीटर तक वॉक कर सकोगी, जो मेरी बहुत दिन से इच्छा है, जो मेरी वॉकिंग नहीं। मतलब हार्डली 5 मिनट चलो, मुझे लगता था ना डायरेक्शन, मतलब कहीं मजबूरी हुई तो कर ली, चलो भाई ट्रिप कुछ पकड़ना है तो अपने कर ली, लेकिन बहुत जैसे अंदर से दिल दुखा के। लेकिन अभी मैंने देखा मेरी बहुत जल्दी स्टिक भी छूट गई है। 2 महीने आज पूरे एक्जैक्ट 2 महीने हुए, 5 दिन तो कराया था स्टिक आने के एक्जैक्ट राइट को, मैं आराम से इंडिपेंडेंट हूँ। और ऑपरेशन के बाद भी ऐसे कि मुझे बहुत हेल्पिंग की ज़रूरत नहीं। इस सर ने कभी ये नहीं बताया कि 99% गारंटी 1% है, उन्होंने हमेशा 100% गारंटी। वो मुझे बहुत अच्छा लगा विनोद सर का। तो अपन निकाल सकते हैं टाइम, लेकिन पेनफुल अगर बहुत हो जाना तो लंबा टाइम खींचना इट्स नॉट वर्थ। मैं तो ये बोलूँगी डू सर्जरी बेटर है, पेन को निकालो, कांटे को निकालो और बोन्स में जाओ। सबको यही सलाह दूंगी कि हिप सर्जरी से डरने वाली कोई बात।
Yes, hip replacement can change your life completely. The surgery is always one step towards no pain journey. Dr. Vinod Agrawal and his well-equipped hospital is always there with you in entire process. Then let's come together and conquer this hurdle and face the new normal phase of your life.